In a detailed explanation and an elaborate thesis, Wunde O'Brien, the zonal coordinator for the Swipes Zone in the East Mungo North Territory, defended in Rio his master's degree from the Faculty of Medicine and Biomedical Science in the University of UY1. Before a very rich panel, Wunde O'Brien explains the advances made by the universal health coverage and the grounds it still needs to cover.
Universal health coverage is a breakthrough for Cameroon, and evaluating this amongst HIV patients, it's actually very, very pertinent, especially when they are dealing with different comorbidities. We see the need for policy to include the management of HIV-associated comorbidities in the management of universal health coverage, as evidenced by the findings of our study. And we are very positive that if this is done, it's going to not only improve the quality of healthcare, but equally the equity that we seek to attain with universal health coverage drive across the country.
Highlighting on the pertinence of the topic, Wunde O'Brien underscores that the universal health coverage is coming to sort out several issues in Cameroon.
The implementation of universal health coverage is really underway. However, it's still in the phase 1. And after phase 1, we hope that the phase 2 is going to be more inclusive. And that's why we're advocating for patients who have other comorbidities, especially patients who are attained with hypertension, diabetes, and other non-communicable diseases should be involved in this scheme in order to lighten the financial burden to avoid the risk of catastrophic healthcare expenditures amongst these patients. And it's going to help the society to reduce the burden that families face in financing for healthcare of their patients.
Seeing him through his work, his supervisor attests that it was a great time working with Wunde O'Brien on this very pertinent topic.
He was a very good candidate who is very pushful and very inquisitive. And working on a topic like the universal health coverage is not an easy topic, but he was able to navigate all that is necessary. He was able to have the interviews, he was able to conduct focus group discussions, and I think this was what was essential in bringing out the fact that a lot of people still do out-of-pocket payments, even for things that universal health coverage should have covered. And I think it's an important finding, which once we make specific, it should be able to be adopted for policy in encouraging exactly how the government intends to correct some of the gaps that universal health coverage still has.
It is worth mentioning that Wunde O'Brien already has a doctorate degree from the Faculty of Medicine and Biomedical Science in the University of Bamenda. This therefore adds to his knowledge in the medical world.